Okay, thanks everyone. This is Roxanne Connelly. I'm now with the Centers for Disease Control in Fort Collins, Colorado. I work within the Arboviral Diseases branch, and I'm the team lead for entomology and ecology. As all of you have mentioned, it's been a strange year, and I just want to give a little bit of an update on what our team has been up to this year since January. We did have one researcher who was able to get some field work accomplished, mainly because he did it here locally in Fort Collins. Again, Nick Komar has been able to do a little bit of field work locally. He's looking at using ivermectin-treated bird feed and helping to control West Nile virus vectors. But for the most part, our researchers were we had no travel allowed this year, and we also had limited access to our building. So what we've been able to do is what I'm going to present to you here today. Normally, we do provide support to states and jurisdictions, but this year was a little bit different in that we knew there were a lot of agencies who were not able to perform mosquito control or mosquito pool testing for arboviruses, and their funds or their people were reallocated or moved over to respond to COVID. So we offered some limited pool testing, and this would be nothing historical, but can we test pools for you that will help drive your mosquito control decisions right now? Christy Burkhalter has really done a great job of working with districts, and you see the states listed here that are involved, and within those states there's several jurisdictions that have been submitting mosquito pools to Christy, as well as Linda Cathera. So far she's tested almost 5,600 pools, and she's also been doing some confirmation requests for West Nile and dengue positive pools for Florida. Additionally, what I call COVID support, Joni Kinney, who is pictured here, has been testing mosquito pools for South Carolina with cytopathic effect. She's also been working with Volusia County, Florida, and other regions in Florida to help with their sentinel chicken testing. It's one of those things that had a delayed start in Florida, but then also once it got started, she's helping with some PRNT confirmation of their sentinel chicken samples. And I can promise you Joni is not dressed for the lab right there. This is actually a photo of her when she was doing some field work in Uganda. But Joni and Linda Cathera have been very busy as well. And I think that this testing that Joni and Christy are doing will probably go through the end of November. And then we will visit to see how things work this year and what we can offer next year in case this is needed again. When we look at our normal sort of support to states and jurisdictions in a non-COVID year, we've continued a lot of that work. Christy has been probably providing weekly guidance to various labs on doing in-house arbovirus testing. We've had quite a few calls with the Florida Department of Health and Florida Department of Agriculture. They've had, if you haven't heard, several cases of West Nile, which Sarabeth will talk about in a minute. They've also had a dengue outbreak in the Florida Keys, so we've been speaking with them about the West Nile virus vector control, insecticide resistance in Miami, and Aedes aegypti surveillance and testing, which a lot of people haven't thought about since Zika, but it's an ongoing concern in South Florida. Dr. McAllister's lab has distributed 74 insecticide resistance test kits since January, and I've put the email address up here if this is a test kit that basically gets you started in doing bottle bioassay testing, and you can request those through the web address or the email address that you see there. Additionally, Dr. McAllister's lab has been doing receiving some egg papers from USVI to do some insecticide resistance testing for them. We've also provided technical assistance to Mississippi and Lee County, Florida on insecticide resistance testing. And then hurricane response mostly by phone. We haven't actually had anyone on the ground, but in preparation for hurricanes that have been coming through Louisiana and Florida, we've been providing technical assistance when we could. And then prior to COVID-19, Janet had actually provided 2 hands-on workshops on insecticide resistance testing. And one of the things I wanted to say about this work that Christy and Joni and Janet have been doing in the lab, we are very limited on how many people can actually go into our building, how many can be in one lab at a time, how many can be on one floor at a time. So, they've been having to work with some pretty restricted schedules, but have still been able to get quite a bit of work done. Wanted to mention a couple of publications that have come out this year. One, I hope you all have seen. This was an MMWR on the continuation of mosquito surveillance and control during public health emergencies and natural disasters. And it was really the first time the CDC and EPA had come together to basically put out a document that says, it's important to continue mosquito control surveillance and control, surveillance and control, not only during times of mosquito-borne disease emergencies, but during non-mosquito-related public health emergencies and natural disasters. And so there we were talking about COVID. We still need to be doing this work with mosquito-borne diseases, but also in times of hurricanes and fires and other things that this work needs to continue. The recommendations we hope is a document that's either been useful to you or maybe in the future. If you get questions from the public or from your commissioners on whether or not this work needs to continue during various emergencies, the answer is yes, and we hope this will be helpful. A couple of other publications, two on Aedes aegypti that have come out this year. We did a review of the control of Aedes aegypti. Basically, this was field work where the mosquito control techniques had actually been evaluated in the continental United States. We have a table with everything that's been done for a number of years. And then working with the Center of Excellence in Texas, there was a paper on male and female Aedes aegypti dispersal from container habitats. The three titles that you see here that are highlighted in green are just to remind people that because we are the arboviral branch, we also work with tick-borne viruses. We're not all mosquitoes, but we did have a few papers on Heartland virus, Powassan virus, and then one paper from Dr. Harry Savage. This is work he did before he retired, and the paper was accepted this year on experimental infection of Amblyomma americanum with bourbon virus. So I want to talk a little bit about funding. The Centers for Disease Control and Prevention awarded over $51 million in extramural funding for response, recovery, and preparation, mitigation, and other expenses directly related to the consequences of Hurricanes Harvey, Irma, and Maria. These were had all made landfall in 2017. The funding that went specifically to vector-borne diseases was just a little over 37 million. The states and territories that received funding were Florida, Georgia, Louisiana, Mississippi, Texas, Puerto Rico, and U.S. Virgin Islands. So some of the intramural work that we did was focused on mosquito surveillance, insecticide resistance, and evaluating of novel mosquito control techniques in those hurricane-affected areas. The extramural funding that went out, the people who received that funding also implemented novel mosquito control techniques. They trained public health pest control operators. It helped replace some of the surveillance and control supplies that were utilized in the aftermath of those 2017 hurricanes. They also worked on insecticide resistance testing and training and source reduction. All these grantees were expected to develop or revise their hurricane preparedness and response plans. One of the deliverables coming out of that Ari mentioned earlier was a special issue of the Journal of the American Mosquito Control Association. It will be released just in a few days. And it brings together a group of authors that from a wide variety of agencies. We had military, federal agencies, mosquito control districts, industry, and it's basically their experience with dealing with mosquito control after a natural disaster. The funding ends this year. Actually, our intramural funds have been expired on September 30th. Some of the states and jurisdictions did get extensions and will be continuing their work for a little bit longer. Ari has already mentioned this notice of funding that came out this year that went to a part of that funding went to AMCA to develop QLEX best management practices document. We're looking forward to the results of that. And then we had 2 broad agency announcements that were funded. We as always, just didn't have enough money to fund all of them, but we did fund 2, one from Michigan State University, where Dr. Ned Walker is looking at insecticide-treated resting boxes to control Culicidum melanura. And the University of Florida is developing a smart cage. So this is a cage that's used in field trials when you're evaluating efficacy of your product that will gather a lot more information than the cages that are currently in use. And I did want to mention the special issue of the Journal of Mosquito Control that I just talked about, that Ari also mentioned. We're going to have a webinar that kind of goes through and gives kind of a sneak preview of these articles. That will be next week on October 14th from 1 to 2 Eastern Time. And AMCA has actually made this one free to non-members, so I encourage you, whether you're a member or not, to please try to attend. I'll just be introducing the topic, and then we have Call Your Mosquito Control District to talk about what happened to them when they had to basically revise their hurricane plans in the midst of a hurricane because they hadn't been revised in a while. Brooks Bowes with VDCI will talk about how the process works when a contractor is called in to respond after a natural disaster. Whitney Qualls was the state medical entomologist in Texas, and she's going to talk about a response to Hurricane Harvey. And then Dr. McAllister with CDC is going to talk about the process with working with FEMA and CDC in trying to get reimbursed for mosquito control after a natural disaster. Here's my email address. I know we're running behind, so if you have questions, I'll look for them in the box, or you can email me here. But at this point, I'm going to hand it over to my colleague here at CDC, Sarabeth Mathis.
Hi all. Let me get my screen pulled up here. Okay. So Roxanne said, I'm Sarabeth, and I am also in the Arboviral Diseases branch here at CDC. I'm the surveillance coordinator for ArboNet, and I'm on the surveillance and epidemiology team. So I'm going to give a brief update on human arboviral activity so far for 2020 as of October 6th. I've seen a couple presentations today mention current or historical ArboNet data. So before I jump into 2020 data, I'm going to explain what ArboNet is for those of you who may not be familiar with it. ArboNet is the National Electronic Surveillance System for arboviral diseases in the United States. All U.S. states and territories report data to ArboNet. It was developed in 2000 in response to the detection of West Nile in the U.S. in 1999. In 2003, we began adding other viruses, and since then, we have included more than 30 different viruses. Most of the arboviruses that I'm going to talk about today are nationally notifiable, meaning cases are supposed to be reported to CDC by state health departments. I also want to mention that ArboNet is a unique surveillance system and that it collects human and non-human data. So now that you know a little bit about the surveillance system, I'm going to start with mosquito data from mosquito-borne viruses. And again, this is reported as of October 6th, 2020. So this slide shows a map of West Nile virus activity reported by state. The dark green on the map represents states that have reported human infections, and the light green represents reported non-human activity. And for each of the maps that I'll be showing you, non-human activity could include veterinary disease cases or infections in mosquitoes, birds, or sentinel animals. So far for 2020, a total of 279 human cases have been reported this year for West Nile. California and Texas have reported the highest number of West Nile cases so far, both reporting 46. And these numbers on the map include disease cases as well as infections identified in blood donors. And as you may know and heard earlier, there was a large outbreak of Eastern equine encephalitis, or EEE, in 2019. So far in 2020, we've had a total of 9 human cases reported from Indiana, Massachusetts, Michigan, and Wisconsin. In light yellow are the states that have reported non-human activity. For Jamestown Canyon, so far 7 cases have been reported from Michigan and New Hampshire. And Jamestown Canyon generally occurs in the Northeast, so this activity is pretty typical. And light pink are the states that have reported non-human activity. And lacrosse cases are generally reported from the Mid-Atlantic region. There have been 43 cases of lacrosse reported so far in 2020. Almost half of those have been reported from Ohio and about a quarter from Tennessee. And this virus is not often reported in non-human species. And so far, no states have reported non-human activity, which is why you don't see any light blue on the map. And the final mosquito-borne virus that I'm going to talk about is St. Louis encephalitis. And there have been 6 cases of SLE so far in 2020. And you can see the light red or pink kind of color indicates states with non-human activity. And in recent years, it's really typical to see SLE in the South and Southwest, so California and Arizona. That's normal for recent years. However, I do want to mention that in both 2018 and 2019, single human cases of SLE were reported from Pennsylvania. And as Roxanne said, we are the arboviral diseases branch, so we do tick and mosquito viruses. So I'm just going to mention a few tick-borne arboviruses of public health importance. And data on non-human tick-borne infections are not reported to ArboNet, so the map only shows states that have reported human infections. So Powassan, which is in purple, is the most prevalent tick-borne arbovirus in the Northeast, where I think most of you that are listening in are. There have been 13 cases of Powassan reported so far this year, occurring mostly in the Northeast. Colorado tick fever, or CTF, which is in the denim kind of blue color, is a virus that you all aren't likely to see, as the vector, which is the Rocky Mountain wood tick, is found in the West. And this year, 19 cases of CTF have been reported, mostly from Montana and Wyoming. And CTF is not nationally notifiable, but it is reportable in several of those Western states. And Heartland is the final tick-borne virus there in the bright blue. It's a newly recognized virus, but we've received reports of 4 cases so far this year, all from Missouri, which is where Heartland was first identified. And then the last thing I wanted to show you was more granular data for the Northeastern United States. And all of this data can be found on our arboviral disease maps that are publicly available. So this map shows all the viruses occurring in the Northeast that I mentioned previously, but this time I'm giving you a look at the county level. And all these viruses have the same color as they did on previous maps: Tripoli in yellow, Jamestown Canyon in pink, La Crosse in dark blue, Powassan is in purple, and West Nile's in green. And then a fully shaded county means that there was at least 1 human infection in that county. And cross shading indicates that more than 1 human infection with different viruses. So for example, Philadelphia County reported at least 1 West Nile case and at least 1 Powassan case for 2020. And then cases that reported only non-human infections or positive mosquito pools are indicated by dots with the color representing the arbovirus. So thank you guys so much. Again, I don't know if we have time for questions, but I can be reached at that DVBID2 email, and so can a lot of other people on my team. And then that link there is the link to the arboviral disease maps where a lot of this data can be found.